Kia ora and welcome to our monthly members meeting of Post-Exertional Malaise. So what is post-exertional malaise? Post-exertional malaise, or PEM, is an abnormal response to minimal amounts of physical, cognitive or emotional effort. It refers to the inability for the body to recover in a normal manner after exertion. It could be triggered by physical, emotional, cognitive, orthostatic, environmental or sensory stresses. What does post-exertional malaise look like? Post-exertional malaise can look slightly different in everybody, but the main characteristics are a disabling and delayed fatigue response, an exacerbation of symptoms which are disproportionate to the effort made. It can get worse between 12 and 48 hours after the activity, and the response can last for days, weeks, and sometimes months. Post-exertional malaise is an identifying feature of ME/CFS, and it can also be present in long COVID. So what causes post-exertional malaise? When your cellular level expenditure exceeds the ability for the body to produce more energy, it results in a drastic reduction in capacity. Symptoms often worsen until energy stores are restored. Post-exertional malaise is triggered by exertion that is outside your unique energy envelope or limit. The energy envelope is the amount of energy a person with ME/CFS has available each day that can be safely used without triggering post-exertional malaise. To understand a little bit more about post-exertional malaise, we must understand the role of the mitochondria. The mitochondria is responsible for producing energy in our cells. They are responsible for converting chemical energy from food into a type of energy that is easily and readily available for the cell to use called ATP. The body uses ATP for all its processes, including organ function, body repair processes, and movement. Studies have found that people with ME/CFS have a mitochondria with lower reserves for energy production capacity compared to people without ME/CFS. Impaired ATP production results in slower cellular processes. Studies have also shown that people with CFS-ME have low levels of helpful mitochondria compounds, but they also have high levels of other compounds that cause damage to the mitochondria. These compounds can create, use, or break down molecules that keep ATP flowing in the body. The creation and use of ATP plays a key role in the metabolism of these compounds. When they are not creating or breaking down molecules correctly, the mitochondria is affected and unable to produce ATP properly. This is why people with ME/CFS find it really hard to sustain both physical and cognitive activity, because the body is unable to produce sufficient ATP to function properly. How much ATP is being produced and how the body recycles it to produce more energy can be measured in a blood test. To support the production and recycling system, we can use supplements, nutrients, and pacing. Studies have shown that brain activity changes during fatigue and cognition pre-exercise to 24 hours post-exercise for CFS patients. The data represents the interaction between changes in the brain activity between groups pre to post-exercise. Let's talk about the push-crash cycle and why it is important to understand how we can avoid it. Pushing through post-exertional malaise can cause an individual to get stuck in a push-crash cycle. This then can cause people to continue to push through the crash state, not allowing for energy restoration to occur in the body. Consider a repeated crash like a repeated injury, which over time can have long-lasting effects and consequences, as well as decreasing the ability to function, like breaking a leg and continuing to trip and fall on the same leg. Over time, the body needs more and more time to recover and refill the energy stores after repeated crashes by constantly being depleted and pushed into dead zone. The body will then find it harder each time to return to its baseline. Everyone can experience post-exertional malaise symptoms differently, but some of the common symptoms you might experience during a crash include pain, sleep disturbances, brain fog, increased sensitivity to noise, light or touch, muscle weakness, flu-like symptoms. Long COVID and post-exertional malaise. Studies have shown that people with long COVID experience post-exertional malaise. The most common trigger found in the studies for both long COVID and CFS-ME participants was low and medium physical and cognitive exertion. The long COVID participants who had been ill for less than a year experienced more triggers than the ME-CFS participants who had been ill for longer. Stress was reported as a trigger. In both groups of participants, the results showed that rest helped recover for post-exertional malaise and pacing helped preventing post-exertional malaise. Sleep, hydration, and diet were also reported as useful management strategies. Now, what can we do when we experience a crash? It is important to plan ahead before you experience the crash, and you can do this by alerting your emergency contacts, making sure that they have access to any health information that they might need if they have to act on your behalf. Have everything you need prepared by your bedside. For example, things to make sure that your vitals are stable, a thermometer, medical bracelet, etc. Have some bottled water, electrolyte drinks to make sure that you're hydrated. And have foods by your side that can be consumed in a variety of ways. For example, some that you might be able to drink or suck on as well as chew. Avoid foods that are well-known triggers. Have medication at hand, pill boxes and pill reminder alarms close by. And conserve energy by aggressively minimizing all activity and movement. Turn down any sensory and environmental stimulus, cognitive demands and physiological fluctuations such as body temperature and body positioning. And practice self-compassion, a wellness to accelerate your recovery. Be patient and learn how to figure out your thresholds. This will help you prevent the next crash. Have everything at hand if a crash happens, but most importantly, give yourself permission to rest and heal. What can we do to avoid post-exertional malaise? It is very important that you prioritize you and what is important to you. So finding your energy envelope using things like activity diaries can be a great tool to help you identify patterns of fatigue and the possible causes. Keeping a diary can help you be conscious of the energy depleting interactions. Creating a pacing plan designed around your energy envelope can help prevent the post-crash cycle. When pacing, a person undertakes less activity than they have energy for. Think about your body as having an internal battery which can only be partially charged. So think ahead and plan your day's activities depending on how much energy you have available in the battery. Recharge between activities. Like when charging a phone, it is best to do so using it and charging it at the same time. There are several ways in which you can charge the battery. A long charge, for example, involves fully resting, minimizing all physical and cognitive activity, and low environmental stimulation. Or a quick charge, which could involve something like breathing exercises, a small meditation, or a body check-in. Learn how to manage your energy even on days when you feel like you can do more. This is really important, as it is important not to be tempted to overdo it. Be mindful of your dashboard lights and also be flexible and manage your expectations on days that you may need more rest. Every day can be different. Learn how to say no and modify tasks by spreading activities over a few days, or try and figure out some shortcuts, or use technology to minimize the energy expenditure and stay within your envelope. It is really important to do what brings you joy. Prioritize something that you love to do, like spending time with your family and friends, attending a social gathering, taking time to spend outside in nature, doing arts and crafts. Recognize that the things that give you joy are important, and therefore saving energy or planning these around your pacing schedule is really important, because joy can also bring you health. Nurture yourself. This can look like letting yourself rest, calming your system by using techniques such as meditation and deep breathing, and practice self-compassion and acceptance. Let's think of some strategies to avoid post-exertional malaise. It is important to do some detective work and find out your own triggers of post-exertional malaise. Learn about your health patterns and treat any other medical conditions that you might have underlined. Plan your day and pace yourself. Ensure that you sleep the best that you can. Maintain emotional health and build your support network. Give your body good nutrition and also track your progress. But most importantly, be kind and compassionate to yourself. We don't always get everything right. Thank you for listening to this talk.